If you cannot squat without pain, even daily activities such as getting out of a chair can be a real challenge. But with some simple instruction, you can make immediate improvement and reduce the pain you're experiencing in these daily activities. And that's what we're going to be covering in today's in-depth tutorial. If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist here at Back in Shape, and we help people across the UK and around the world fix their back pain and get back in shape for the long term. So no matter your current ability or pain levels, this video is going to help you do two things. Number one, make instant improvement with some modifications and tweaks. And number two, give you real strategies to make long-term changes to improve your mobility and ability as you age. There's timestamps underneath for your convenience. Now let's get into the mistakes so we can stop making things worse. There are three simple mistakes that people make when they're doing the squat, and these can be instantly remedied. And we're going to start off by doing the first one, and you just evaluate all of these in the actual squatting motion. And what this looks like is as people squat down, they kind of go up onto their toes. And as they go up onto their toes, it's because they can't get any lower because of the ankle. And that's what we're going to address in this first instance. But this puts shearing forces on the knees, puts them under pressure. It also makes you a little less stable. So if we're trying to do anything, carrying any weight or anything like that, it can really be problematic. A great way to test this now is to go against a wall. I've got the block here just to make it easier for me, and pop your leg down like so, around about a fist's length away from the wall, and simply push your knee towards the wall. And see, keeping your heel on the ground, see how close you can go on each of those legs. Again, use the same fist distance away from the wall and push forwards to see how easy it is for you to actually get that knee to touch the wall from the fist distance. You might find that okay on one leg, but not on another. And if you struggle to get that knee in that direction with the heel remaining on the floor, then this drill is going to help you make some instant improvement. So what we're going to do to actually improve the ankle is just repeat the test in many ways, but with a little bit more focus. This works really nicely if you do it on a small chair or even on a table, depending on your hip mobility. You can also do it on the floor. It's just a little bit more crouched down. I'm going to use the block here because it really works well about this height. You pop your foot onto the block and then simply push forwards and lean your weight through that ankle. This is the first step, and there's a couple of extra modifications we can make. If you find that as you do this, you're getting a bit of a blocking sensation in the front of the ankle, that might be because those joints aren't gliding effectively. One of the things that you can do here is to literally pop your thumbs on the front of your ankle and press back down in that direction if you have no other equipment. So as you're pushing forwards, you're pressing backwards with your thumbs on the front of that ankle joint. Hold the movement and then back off. Pop those thumbs back onto the front of the ankle. Hold the movement, push through and down with the thumbs, and then come back off again. And do this for around about 30 seconds to a minute, holding each articulation or mobilization for a couple of seconds, really focusing on those thumbs, pressing down and back through the ankle. If you're lucky enough to have resistance bands at home, we can make this a little bit more effective by using the band instead of our thumbs. If you have the equipment, using something like a band can make this a little bit easier and more comfortable to do, so you can focus on a more powerful mobilization through that ankle to improve the dorsiflexion. And we can simply do this by anchoring the band to the doorway or something like that, moving away so we've got a bit of a stretch, the band position again on the front of that ankle, and now we've got a free hand, once it's in position, to just lean on that front leg, lean on the thigh bone, just to improve the articulation. So the band is pulling back through the front of the ankle joint as I press down on the front of the knee to really improve the mobilization at the level of the ankle. Once we've done this, we can go back and retest. So after doing that for around about 30 seconds to a minute on each leg, with or without the band, go back and retest that evaluation, and also retest your squat to see if you feel a little bit more comfortable going down through the range of motion. It should help you plant your heel. Mistake number two is going to contribute to that strain developing on the knees. And that's as we go from the squat down like so, our knees start to buckle in. They're not stable and they're not being held in their position. And people often think this is because they've got bad or weak knees. They might have bad knees as a result of this movement, but it's actually because the muscles up here are not holding the knees out in their correct position. And we're going to do a little drill to help you activate these muscles to instantly make a change and protect your knees as you go through the squat more smoothly. Just like the last tip, we've got two variations of this. The first one, for those of you that have no equipment at home, the important thing is we just stand next to a wall so we've got something to support ourselves so we can hold our body steady. We're going to work on one side at a time, and we're simply using our body weight. All we're doing here is opening the hips out as far as we can, and we can always, to make this a bit more effective, turn our foot down ever so slightly and really feel that the muscle just on here on the side of the hip is really quite tight. And then we come back down and we really squeeze out as much as we can. Try not to bend your spine one way or the other. This should just be a hip movement, strengthening these muscles on the side and getting them to wake up a little bit more. So coming out to the side and back, turning that heel up and toe down and back, heel up and toe down and back, like so. Working on 5, 10, or even 15 reps, squeezing at the top of the repetition. Do this on one side, then repeat it on the other, and then get back in and do the squat in front of a mirror or in front of your camera to see how you feel about holding those knees in place. You should find that it makes some instant improvement. Now, if you happen to have a glute band at home, then there's another variation that's a little bit more efficient and, I would argue, a little bit more effective. If we've got one of these glute bands, a great alternative to what we just discussed, which will help you work both pretty quickly and efficiently, is going to be just doing simple side steps, taking a large step to the side, a large step the other way. Make sure you're in a kind of a semi-squat here, so we've got our bum back a little bit, we've got our thigh muscles engaged, our core and spine is braced nicely, and we're just going left and right, and you might do 20 steps, 1, 2, all the way up to 20, just to really get these muscles tightened up ahead of doing a retest afterwards, or even before you do a working set, as we'll discuss later on, to really get these guys woken up. So when you go through that squat, your knees aren't rolling in. For mistake number 3, this is the root cause of a lot of your lower back pain and why it doesn't get better. And this is the rounded spine. As we squat down, we do not maintain core composure and a neutral spine. And instead, as we go down, we start to round. We've got that as an example. Some people will go like this. It really does vary. But the important thing that we're doing wrong here is compressing the discs as we round our spine, rather than holding everything nice and strong and stable. If we've got a lower back injury, for example, a disc herniation or bulges or some degenerative change down there, this is really going to aggravate that area and hold you back. So we've got one great simple solution. I won't cover it here, but there's a link in the description, and that's the tape test. The tape test is where we essentially stick some sellotape along our spine here. So as we squat down, we're holding everything steady. And if you fail to do this correctly and round your back, the tape will pull on your back and you'll get an extra bit of information to say, hey, you weren't holding the spine steady, try it again. Use that video, link in the description, to really help you work on this to get it right, especially if you find you have lower back issues or sciatica. It really will help you loads. With all of these 3 mistakes, once you've done a little bit of work to correct them, done some of the drills we've just mentioned, tried the tape test, always go and re-evaluate. Try your squat again, and steadily over the days and over the weeks, you'll find your form gets more and more comfortable without making these mistakes. And that can really have some very dramatic short-term impacts to reduce the amount of pain that you're getting in your knees and your lower back from daily activities that involve the squat. For some of you, even those drills are going to be a real challenge, and it might be that you don't have the strength. Often people subconsciously, and you'll know someone who does this, pull their knees together when they get out of a chair because they don't have enough leg strength. So even doing a relatively normal squat is actually not possible for them to do without bringing the knees in, because there's just not the strength there. And that's why we've got 3 strategies now to help you make the squat easier so that you can then build back up to do a proper squat over time. But it's like adjusting the difficulty of the exercise in alignment with your personal starting point. And everybody starts at a different place. Some people can't even get up off a chair without significant support. Others can do squats with a significant amount of weight. So some of these strategies will help those of you who maybe have a little bit more weakness than the average person. The very first thing we're going to do is just reduce the depth. It is so much more difficult on your musculature and on your balance in all areas to go and squat down to here than it is to squat to here. We're all stronger in this position. So the most important first step for you is to find what depth of half reps or quarter reps is a range that you can do and not make some of those mistakes we've just discussed. It might be that you can only go down to here and back up again with control. Well, if that's the case for you, that's where you start. For others of you, you might be able to go a little bit lower. But using a mirror in front of you and maybe a camera from the side, you can really start to get this right pretty quickly and find the right level for your current starting point. When it comes to the depth of squats, if you are not very strong in your leg muscles and in your back muscles, then it can be really daunting to even sit down in a simple chair. And that's why when you're practicing these half reps, it can be really helpful to have a little bit of a support. This could be a chair with a few cushions placed on it, or it could be something like this, a higher than usual chair, a point at which you know that even if you fail, you've got a little bit of support to rest on. And so to demonstrate here, I've got the squat. I know I can't go very deep because my leg muscles aren't very strong. So I know I'm just going down to this point here. If I lose my balance, I can just sit on the chair and relax. But I'm using this as a standardization tool so that I know that every time I do the squat, it's to the same depth. And all I do is I kiss my bum on the seat. I don't rest, and I do my half reps, watching really closely. 1, 2, 3, and so on. And slowly over time, I can potentially bring it down a little bit lower. And then I can go 1, 2, and so on. You get the idea. Maybe you're going to move down in smaller increments, but using a support to give you that confidence that even if you mess up, you're not going to end up falling on the floor can be a real important thing that you must do when you're learning to make this a little bit easier for you. The next thing we can do if we're still struggling to do that ourselves is use a support. Now, I've got the band hooked up to the squat rack here, but it could be something like a towel wrapped around the door handle or something like that in the house that just gives you a support. It could even be your other half, a friend, just holding onto your hands to give you that extra level of confidence when you're learning some of these things. Because we don't want to fall over. We want to give ourselves the support we need if we're starting from a very low level of strength. And all we're going to do here is hold on to the support, whatever it may be, and then go into the squat position, knowing that we've got someone there or something there that's just going to support us, and we can use our arms to help take some of the strain off our legs while we're learning to do this correctly. Again, at all times, focusing on not making those 3 mistakes we discussed earlier, keeping the back neutral, keeping the knees from going in, and preventing us going up on our toes when we're doing the squat. The last step we have, if you really can't bear weight on your own body, maybe you've got really, really bad knees, your back is really struggling, then using the band in a slightly different capacity can be a great starting place. And this is really if your legs are very, very weak, or as I said, you've got weakness in these areas. And that can be simply sitting down, maybe in your armchair or something with a bit more support than this bench, holding onto the band with your hands and simply doing a leg press out like so. And just carefully going through the range of motion with significantly less than your body weight to start to build up a little bit of strength. And in all of these scenarios, doing something like 10 good reps, going out and back in again for 3, 4, or 5 sets will help you start to feel the muscles of your legs, the muscles of your buttocks starting to work. And slowly over time, they're going to strengthen. You can move from this variation to the supported, to the assisted, to the half reps, and then into something that looks more like a full rep squat. Depending on where you start, that'll take a different amount of time. So now I've got all of the safety stuff out of the way. You've got a good squat. You're not going up on your toes. You're not getting your knees wobbling, and your back is supported nicely. We've got 3 steps for you to now make long-term improvement in the squats. And that's starting to, using 3, 4, or 5 sets of 10, scale the resistance that we're using in a sensible manner. And we'll explain why we choose these particular items in this order as we go along. And the very first one is using resistance bands again to start to challenge our muscles a little bit more as we do the squat. As I mentioned earlier, the squat, like other movements such as the hip hinge, and there'll be a link in the description to that tutorial video, the squat is very strong at the top and mechanically weaker at the bottom. So the band works really, really well to give us a little bit of grace as we get to the harder part of the repetition, but still challenge us at the top part. And when we're using the band, it's always best to loop it around like I've got it here, and then bring the arms up to your chest height. This will be important later on when we start using weights as well. The reason we do this is if you are a little bit more inexperienced or a little bit weaker or struggle to activate some of these muscles, the action of bringing yourself up to this position helps you engage all of your back muscles up at the top part of the back, the core and the lower back muscles to hold the band in this position. Otherwise, you're just going to fold forwards. So you consciously engage everything. As opposed to if we hold it down here, I can kind of be a little bit relaxed at the top and not engage things, and that's when problems happen, particularly with the rounding of the spine. So we bring it up here like so, and then we simply go through the squatting motion for 10 reps. 1, 2, being careful to keep our spine neutral, being careful not to go up on our toes, and being careful to make sure that our knees stay going in the same direction as the toes for, again, 3 sets, 4 sets, or 5 sets of 10 reps. Now you can progress and use stronger and stronger resistance bands, but at some point, especially if you're doing this in the gym, you're going to want to start using weights. And that's where we can use either a kettlebell like this, or we can use dumbbells as this first transition. And again, we're going to follow the same strategy. We're going to hold these up to do the goblet. And there's a number of reasons I'll touch on in a moment that the goblet is good, but all we're going to be doing is exactly the same movement. We're engaged nice and tight, we're nice and comfortable in our stance, and then we're going through those 10 reps of the squat, like so, keeping everything nice and strong. As we do that, core engaged, back muscles engaged, knees in alignment, and feet planted firmly on the ground. Now, there are a couple of reasons that both the resistance band variation and the weights variation come before we get onto the barbell over here. And this is number one, as I mentioned a moment ago. It forces us to more conscientiously, even if we wouldn't otherwise do so, engage our upper body musculature, including the lower back and core, more effectively than if we hold the weight down here. It just forces that engagement, which is protective. It helps us prevent, in particular, the lower back and knee issues from occurring. The second one is that it's a little bit easier for us to balance with a weight out in front of us than the variation we'll get onto in a moment with the squat bar on our back. So it's a nice stepping stone to add resistance, but make the exercise a little bit more favorable. And even if we're using heavier weights, we can also use these as a counterbalance to go a little bit lower. So for example, if I use my own body weight, there's only so far I can go before I'm going to topple backwards. Whereas if I've got a nice counterbalance here, I can hold it out in front and I can actually squat really quite deep because I've got that counterbalance, which again helps you work healthy, full range of motion. The final point is that if you've got any joint issues, the knee, the ankle, and particularly the lower back, as we see with patients and members, over the years, sometimes for those of you that have a background in exercise, your muscle memory will mean that you can scale the resistance quite quickly. And you'll find that when you're holding the goblet squat up here, the limiting factor that stops you increasing the weights will actually become your upper body strength. So it acts as a kind of dampener on the speed at which you can progress your weights and cause you to just take it a little bit more slowly so that some of those joints can catch up to the rate at which the muscles are changing with your good workouts. These are some of the strategies that we teach our members in the program, because ultimately your discs in your spine, which are often injured in our members, they take longer to heal than your muscles. And having these opportunities for us to slow down the progress rather than using straps and other equipment that's common for gym goers to lift more weights than we can perhaps hold on to can get us into trouble. So just having these safety rails on our progression can really lead to longer term results rather than trying to push ahead too fast, injuring ourselves and going back to square one. So the final step here is obviously going to be using the barbell. The barbell is going to allow you to continue to progress and build the strength of your squat over the long term. Again, the same rules apply here, but obviously adjusting your balance is going to be important. And we're simply going down using the same training points, keeping our spine nice and neutral, keeping our core engaged, going as deep as we're comfortable to do so, keeping our knees from rolling in, and keeping from going up on our toes when we're doing this. I'd strongly advise if you're doing this in a gym, just like we do, which is why they're set up here, having the safety bars on to make sure that if you do fall or fail, as sometimes happens if you're pushing yourself too hard, you've got something there to catch you. Doing it without safety is not a good option and can lead to increased risk of severity of injury. Ultimately, using the squat to improve your mobility, improve your joint strength, improve your bones and muscle health can really pay huge dividends as we go through life and get into our retirement years and beyond. It's something that we should all be mastering because it offers such great opportunities and efficiency for improving all of those parameters. No matter where you start, with whatever variation we've discovered, make sure you're doing technique right first. Once you've got the right technique down, which can take a couple of days to a week or so, you can then work on that 3, 4, or 5 sets of 10 reps, resting for about 30 to 60 seconds between each set. And as time goes on, you can progress through the difficulty variations, going from body weight to resistance bands to goblet squats into final squats in the gym, to continue to build strength and resilience to your body. We've seen enough people over the years with really bad backs to know unequivocally that being stronger on this pivotal, true to life movement will always have a dramatically positive impact on your back, knee health, not to mention a huge number of other general well-being parameters. We hope you found this tutorial on squats really helpful. Remember, the sister exercise to the squat, the hip hinge, we've got a full tutorial on that, link in the description. If you know someone else who's been struggling with their back, their knees, you've seen them rather gingerly and rather painfully getting out of a chair at the latest family gathering, or when you've last seen them, then consider sharing this video with them. It will make a positive change to their well-being for the long term. As always, thank you for watching it and making it this far through the video. Hope to see you in the next one.